Hi, my name is Dr. Robert Rosenfeld. I'm a graduate of Cornell University and Northwestern University Dental School. I then completed what was to be a one-year general practice residency at Long Island Jewish Hospital and was invited to stay on a second year as chief resident, which I did. I practice in Westwood, New Jersey, which is the extreme northern part of the state. I have a general practice. I see patients of all ages and all types of procedures. It's not a boutique practice limited strictly to cosmetic dentistry, for example, although that is one of the things that I enjoy doing. I enjoy crown and bridge, including full mouth reconstructions, but the full range of restorative stuff. First, we have to establish that Omnichroma comes in both a conventional composite as well as a flowable. Flowables handling is obviously different. It's got sort of a medium viscosity as flowables go. It's great for an initial layer for its adaptability. Like all flowable composite resins, it has a little bit more flex and so less of a tendency to pop out of class 5 restorations. The conventional material, which is available in syringe or compule, has a creamy consistency. If I'm being honest, there are other materials that I have used that are just a little stiffer that I might like, but I've used Omnichroma extensively. I'm now more accustomed to it. It does exactly what I need it to do. It doesn't slump tremendously, so it handles nicely and yields good results. Now it's also available as what's called a blocker, which comes in also a flowable or a more condensable form. That's meant to block out darkness that might be visible through a tooth from the rear of the mouth for anterior applications like class 4s. And now the newest addition, Omnichroma Flow Bulk, is a bulk fill material. It has good handling characteristics, and it has a depth of cure at roughly 3.5 millimeters. It does not require a capping layer, and of course it has the benefits of the whole family of Omnichroma products in that it can adapt and match the color of its surroundings. If need be, it can be placed in several increments to fill up the entire restoration and then be shaped with a handpiece. Or if you wish, you can use a capping layer of regular Omnichroma material, which will obviously allow you to create your occlusal anatomy. As is the case with all flowable products, the Flow Bulk has the advantage of the great adaptability to the cavity preparation. So it will limit the kind of sensitivity problems that can be experienced when there are voids. And again, you can use this or the other flow material routinely under conventional restorations, but the advantage of the Flow Bulk is that you can make your entire restoration out of that one material. I've been using Omnichroma pretty much since its introduction to the market, and I learned afterwards that Omnichroma had perhaps done some bench testing of its ability to sort of adapt to the color of the tooth in which it's placed, even as the color of that tooth changed through the bleaching process. But they didn't have an in vivo case. I had a patient, I just presented moments ago and showed this case, an extreme bleacher. She had been using home whitening extensively, and a restoration that I had placed in her tooth close to 3 years earlier now looked darker than all of her surrounding teeth. And she wanted me to replace it, and I informed her that were I to use any material, we'd be having this conversation again 2 years from now because she doesn't stop bleaching. And then it dawned on me that, gee, I have a material that claims to be able to match or mimic its surroundings. So if the surroundings change, shouldn't the material do so? And I said, I can't promise that that's the case, but my gut feeling is that it ought to be able to do that very nicely. We placed it. She was thrilled with the outcome, and of course, the material, when it comes out of the tube, does not look like other composites. It's opaque and white, and it's only upon polymerization that it takes on the appearance of its surroundings. But she was very pleased with the outcome at the initial placement, and we continued to monitor its progress. She came in maybe 5 or 6 months later. She had bleached an additional 20 times, and the restoration was keeping up beautifully with its surroundings. And then I can't remember, the longest follow-up I have was somewhere in the vicinity of 2+ years. And once again, it continued to match its surroundings very, very nicely. And she's the kind of patient who spends a great deal of time in front of the mirror. She's seeing things that others around her don't see. She's very critical of it. And if we were able to please her, I assume that it would please most people. It performs every bit as much as well as we would hope it would. Once again, Omnichroma has been up to that challenge. In my presentation or in some publications, I've shown the adaptability in teeth ranging from A1 for a young patient to beyond A4. Many people do not have kits of conventional composites that includes shades beyond A4. There's a few that are out there, A5, even an A6, but without those, there are instances when the average dentist would be unable to make a compatible match. Omnichroma has performed very nicely in teeth beyond A4, including a patient I have with what probably would be termed tetracycline staining. Parts of the tooth extremely dark, and it adapted very, very nicely. Tokuyama has been making composite resin restorative materials for many, many years, and they have a fine reputation. They're used by some of the finest, cosmetic bonding specialists. I have found Omnichroma to hold up literally as well. The formulation is a little different, perhaps a slightly modified filler particle size, but in all respects, it has held up beautifully. There's no evidence of ditching. The color is stable. It has performed very, very nicely.